We're going to talk about some facelift and neck anatomy. Neck ageing is one of the things that people most commonly come for to discuss in relation to improvement in their appearance. And the cause of an imperfect neck can either be completely inherited, so the way our neck is shaped we inherit from our parents, and sometimes it can be as a result of ageing. And if you look at any 90-year-old, regardless of how good their neck was, it'll be an aged neck with all the visible stigmata of ageing. So if we think about, let's conceptualise what a great neck would look like. So what a great neck would look like is a cylindrical shaped round trunk of the neck, and the jawline being a fairly flat plane. So a fairly sharp jawline with a well demarcated edge of the mandible or jawbone. So it's a cylinder meeting a flat plane is the ideal neck. In terms of neck anatomy, some people really do have that, and some people never have it from the time they're 6 years old. They haven't got a perfect neck shape, and that's just the way we are. There's nothing bad about not having a great neck, it just is the way that you were born. The things we see surgically and we look for are things like skin quality, the platysma, which is a flat muscle that runs from our lower cheeks to our upper shoulders and collarbone area, which can pull off the neck, and it creates the strands or bands in the neck. Fat deposits in the neck, some people inherit a fat deposit in the neck. The submandibular gland is a salivary gland that lives under the jawbone, and in people with fairly small jawbones can push out below that, creating lumpiness. And finally, the way the neck attaches to, the skin attaches to the deeper tissues. Some people have those necks that really look completely sculpted, and some people have a more straight across or a more downward sloping shape in the normal way that their skin attaches to their body. And you can usually see that in teenagers. You can kind of work out what's going to happen in that individual. Again, nothing wrong with any of it, it just is the way that we are. So surgically, what we're trying to do is to create a smooth round cylinder to the neck with a flat plane above it. And it can involve fat removal, releasing some of the skin tethering. It can involve a platysmoplasty, which is restoring the muscle sling under the chin and dividing sometimes the muscle in the mid-neck. And it's a useless muscle, it's fine to divide it, in fact it's a good thing to divide it. Very uncommonly, it can be removing some muscles under the chin called the digastric, or sewing them together to try and create a flatter plane. I do that very rarely, not often at all. Removing the submandibular glands if they bulge out, or a part of them, is also something that's done in neck lifting. And I do that occasionally, not all that often, but sometimes you just got to do it to get a decent result. Once the actual deeper structures are smoothed out, then if the neck is loose and the skin is loose, then moving the neck skin up and lateral and attaching it to the important, strong structural areas around the ear, above and behind, are the way to then create some tone or a sling in restoring the neck. So a neck lift is not just pulling skin, it's having a concept to work from the inside out to see what's getting in the way of creating a good shape. Pulling skin over a bad shape will not give you a durable neck lift.